Sanford Health allergist Nikki Patel says milk allergy is quite prevalent in younger kids.
Milk allergy is one of the ones that tends to be more likely to be outgrown as children get older.
However, she says there are some people that may have milk allergy into adulthood. The symptoms are wide-ranging.
For some children, it can flare up their eczema to be worse. For some people, milk allergy can cause symptoms such as hives, facial swelling, shortness of breath. For some people, it can induce something called FPIES, which is food protein-induced enterocolitis. And so that can cause vomiting, diarrhea, like feeling very lethargic and very pale and having decreased muscle tone. So milk allergy can kind of encompass lots of different types of symptoms.
Patel says there are two types of tests to check for milk allergy.
One is the skin test, and sometimes people can't do skin testing because they can't be off of certain medications that affect the skin test, so then we have the option to do blood testing. And oftentimes, even if we are able to do skin testing on patients, we do the blood testing just to confirm the results.
Patel says the process of testing for allergies has become a lot more painless the last 20 or 30 years.
And so it's a pretty simple procedure. We just have people typically lay on their stomach because we apply the test to the back, and we just press these plastic tip devices on the back, and we leave the liquid on the back for about 15 minutes. And then we have our answer, typically at that same appointment on the first day. And then the blood testing is just a simple blood draw.
Patel says milk can sometimes be tolerated better for people when it is in baked goods, rather than a glass of milk or ice cream. Depending on severity of the reaction, you could be prescribed an EpiPen.
If you are allergic to all forms of milk, that would include very detailed label reading in terms of foods that you order, making sure that a waiter or server at a restaurant you go to is aware of the milk allergy.